Hi, everybody. This is Dr. Eliana Aaron, Director of EMA Care. It is May 21st, 2020, and today we're going to talk about taking care of our elderly parents. Can we see them? Can we visit them? How are they categorized as high risk or not? So we're going to start off by talking about, are they high risk? Okay, so we know that age 70 and over is considered high risk just by definition of their age. But there are risk factors that put people over the edge and make them severe high risk. So first of all, let's talk about some of those categories and how those categories impact decision making regarding visitation, going to work. A lot of people in their 60s and 70s still go to work. So the Israeli Ministry of Health has recognized 6 risk factors that are universal for any age group. And then the age category defines how many of these risk factors puts you over to a higher risk category. I'm going to explain what that means because it sounds confusing. The 6 categories are high blood pressure, blood vessel or heart disease, anyone who's been smoking 10 years or more. Any hospitalization in the last 3 years is counted as a separate point. So if you were hospitalized twice, then that's 2 points. And the point system is important here. Diabetes and obesity, which means a BMI or a body mass index of 30 or more. Which is obviously more than just being overweight. It's a certain measurement, and you could calculate your BMI with a simple Google search. So those are the 6 categories, and basically the way that it works is that based on your age, a certain number of those is considered okay, and then beyond that, you get into a higher risk category. So anyone who's under the age of 50 is considered automatically low risk unless they have 4 points or more of these risk factors. So if you were hospitalized twice and you have diabetes and high blood pressure, then you have 4 points. And that means that you are now at the next level of risk. Anyone from age 51 to 69, they just need the 2 points in order to be considered a high risk. And anyone age 70 and over is automatically, just by age. Remember, COVID unfortunately really attacks the elderly. They're automatically considered at least a moderate risk. So people 70 and over, it's not recommended that they go to work. It's not recommended that they have huge amounts of exposures, and we're going to talk about details about that soon. For people who are over 70, who also have risk factors, 3 or more risk factors, they really need to continue being quarantined or isolated, which means they should have access to nobody except their immediate caregiver or spouse or both. About half of the population of people age 70 and over falls into that very high risk category. So about 50%, we said automatically they are a moderate risk. So 50% is in a moderate risk and 50% is in a high risk. There are no low risk people age 70 and older, and that's a very important factor to keep in mind. So what does that mean? If you are, you have to look at a situation holistically, okay? People who have been, I'm right now only talking about people who have been extremely careful about keeping to the regulations, about wearing a mask. We have this wonderful campaign now, hashtag proud to wear a mask, and it's gaining a lot of momentum. We've had thousands of people who are going on to that group. But wearing a mask is extremely important to reduce other people's risk, but also to have somewhat of a reduction of your own risk. So keeping good hygiene, staying away from high-risk people, avoiding socializing, which still has not really, it just started opening the door in that direction with the shuls being opened. And if you yourself are not a high risk, then you can and should visit your older parents, especially if they're in the moderate category. Okay, so for sure they can come for Shabbat. I don't advise, a free-for-all. I think it's very important to make these decisions very carefully. Remember that we have to protect this population, and the only people who can is us. We have to protect them because they're very vulnerable. So I'm not talking about the extremely high risk category people right now. I'm talking about the lower risk category, which is moderate risk for elderly people. And they can visit a household if there are no high risk family members. Everyone is feeling well. This is obviously, we're not going anywhere and we're not inviting anybody ever at any age if we are not feeling well ourselves. If we are keeping to those restrictions, then we can visit with them. It is important that that we maintain a measure of caution. Okay, so not only about not feeling well, but also I wouldn't really go with a lot of physical contact at this point, especially until we know that that's safe. Now, if you have started going to the mall or going to shul or any of these new categories that have opened up recently, schools, ganim, anything like that, it is prudent to wait 2 weeks before exposing people over the age of 70 to make sure that you are okay. Because remember, you can be a silent carrier, you could be developing symptoms, we just don't know. So when you have these new exposures, give yourself a 2-week cushion there before you invite your parents for Shabbat. If they're very high risk, I don't recommend that they come for Shabbat. They really do need to be very isolated because they're extremely high risk. Remember, that's somebody who has at least 3 points of those 6. Okay, it can actually be more than 6 if you've had multiple hospitalizations. 3 points and over the age of 70 is the highest risk category. Okay, so again, you can check up on your parents remotely. I would help them with buying supplies. I'm sure everyone knows this already. Help them get medical appointments. IMA Care has been helping elderly people get medical appointments and make arrangements for them for years already. Because a lot of the time people live here, they're elderly and their kids live in the States or they live in England. And we take care of them and we make sure they're getting everything they need. Nowadays, you have to make sure that a lot of those visits are telemedicine visits, and it can be tricky. So make sure your parents are getting telemedicine visits as much as possible, and monitor their health and well-being. Okay, if you visit your very high-risk elderly parents because you have to, you want to, whatever it is, I think that it's extremely important to maintain strict social distancing, strict use of masks, no physical contact, limit the amount of time that you are together, and if possible, try to meet outdoors. Sit on the merpeset, try to reduce the risk altogether of potentially harming this population. I think that's extremely important. So we're removing ourselves 2 weeks from any of these new things that are going on. So the pools open up 2 weeks. We should not be in close contact with this population. And it keeps going like that. So there's windows of opportunities, but for high risk populations, it's prudent to do this because we don't know how things are going to go, how safe they are until about 2 weeks later. And it's just a smart thing to do. So I think that that's some of the factors to consider with elderly parents. For people who have caregivers, there are now regulations about the caregivers. They either have to live in the house with the elderly person that they care for, or they oftentimes rent apartments with a lot of other foreign workers. These are all foreign workers in Israel. And now they are not allowed to live in these high occupancy apartments. They have to live in low occupancy apartments, a maximum of 3 people, where each of them only works for one family. So they have minimal exposures. So it's important for anyone who has an elderly relative with an aide to know where that aide sleeps at night, where they go for the weekends, because they are not allowed to be in these high occupancy apartments anymore. And that came out, I would say a couple weeks ago, probably. So very important to note. Another issue that people were talking about is grandchildren. Okay, so we know already that very young children, less than age 10, have a much higher chance of being asymptomatic carriers. About 25% of cases have no symptoms. That's what we're seeing here in Israel, at least. Remember, there are different strains, so I don't want to generalize. But we do realize now, unlike the very beginning of the pandemic, that children are much less infectious than previously thought. So it's less likely to catch the disease from a child than it is from an adult. We don't know why, but that's good news for grandparents. Okay, that means that grandparents can spend time with their grandchildren, especially if they're low risk, according to the criteria that I gave. Some restrictions should be maintained for people who are moderately at risk or medium risk, which I also talked about, okay? For people who are extremely high risk, you need to have limited contact. And for people with moderate or high risk for sure, but certainly moderate, you need to wait 2 weeks after they start gun or school in order to visit with these higher risk individuals. And I think that that's a really key important thing to consider. So when we're talking about kids going back to school, we don't know what that's going to mean. We don't want the brunt of that decision to be on the health of higher risk people. So kids should go back to school, okay, but not at the expense of their grandparents. So grandparents are going to have to hold off. So right before a lot of these kids went to school, grandparents quickly had them for weekends and Shabbat so that they could see them and enjoy them before they go to Gan and then become higher risk again. I hope this has been helpful. And we're going to have another video tomorrow, hopefully, but definitely by Sunday to talk about some of the challenging trends that we're seeing out of China, which may give us a hint of what is to come in the second wave. So I hope everyone has a good weekend. Take care.